Welcome to the Global Education Campaign for All Pediatric Endocrinology hosted by ICOSEP. This is a crucial and important program to teach the world how important endocrinology is to the lifetime of health for all children affected. Children's growth and more than 1,000 medical conditions relating to children's health, as marked in their physical height development, is a serious issue which is not commonly understood. Therefore, children are not diagnosed nor referred to pediatric endocrinologists properly. ICOSEP and the medical societies around the world are joining together to change the general public's understanding of the importance of monitoring children's growth and build respect for this extraordinarily important profession and health sign. ICOSEP began in 2013 with 7 patient advocate organizations. Today, ICOSEP has more than 100 member organizations representing 35 countries. Membership is free to qualifying organizations and medical associations who support any medical condition which impacts a child's growth. ICOSEP is funded and hosted by the Magic Foundation. Members receive free membership, Friday email medical updates, invitations to the annual membership meeting, and free artwork for their organization to use in the Children's Growth Awareness Educational Campaign. International Children Growth Awareness Day. Project Goals and Objectives. To increase awareness on the importance of growth as an indicator to a child's overall health, encourage regular measuring and plotting of children's growth, drive earlier referral of children to specialists upon identification of irregular growth, build global understanding as to the serious considerations of children's growth patterns, encourage governments and other authorities to realize that early identification and treatments are better for the lifelong health of their citizens. Each year on the 20th of September, ICOSEP coordinates a global outreach campaign in which all member organizations and the medical community share a united educational message about children's growth that focuses on health and not height. Children's Growth Awareness Day is consistent throughout the world. However, in North America, they have expanded this important campaign throughout the entire week of the 20th of September. ICOSEP Governance. ICOSEP has an advisory committee of patient advocate group leaders from around the world. It acts as the global coordinator uniting endocrine advocacy groups, provides an information exchange sharing of resources, business experience, and public awareness, provides and maintains online global children's growth awareness, and provides free resources and translatable materials. ICOSEP also incorporates an ambassador board of volunteers who assist with translations and growth awareness campaign efforts. In today's world, parents of young children most commonly receive world news from conversations or online resources. Therefore, ICOSEP focuses sharing our message mainly on social media to educate young parents, grandparents, and the population in general. If we band together, the false impression that growth is only cosmetic or not of value to a person's health can be reversed, but it will take all of us working as a united team with one message to make this happen. Our social media campaign offers artwork to be used by support organizations on websites and social media accounts. We encourage members to edit the artwork to include your organization's logo and information. ICOSEP may be able to assist with customization of the materials per request. The only requirement is that the wording remains consistent. It can be translated so that we build an authoritative and valuable message. ICOSEP members encourage social media activities through their individual accounts and members. Parents of growth-affected children and adult patients have learned that endocrinology is undervalued. With the exception of diabetes, the average person is not aware of how many medical issues and how much our health is dependent upon a healthy endocrine system. Too often, parents wait to see if their children will catch up in growth, while undiagnosed problems continue to destroy their health. Even government officials often deny medical care for children because they are unaware of how important endocrinology is for them. We must unite to change this misunderstanding. We must increase public understanding about the importance of endocrine issues to long-term health. We must validate treatments. We need to build a global voice which can be heard. We need recognition of the healthcare organization's participation in ICOSEP publications. We need to unite patients, physicians, and supporters to overcome obstacles in diagnosis, treatment, and availability of medical treatments. We need to build respect for one of the least understood and most important medical professions. We need to decrease noncompliance and reduce follow-up and questions from patients. And we need to increase treatment options available as more importance is given to endocrine issues. Endocrinology must be recognized as a serious concern. The only way for this recognition to occur is for all of us to unite in message and effort.